Hello and welcome to this emergency medicine case on an ultra-raised D-dimer. So this was a GP referral into ED with a raised D-dimer. It's a 50-year-old male with 1 week of right calf pain which are currently resolved, with no past medical history, a normal examination with no calf tenderness, and normal observations except for a tachycardia of 101 that fell to 80 on one repeat. And the GP had organised a right Doppler which ruled out a DVT. So to summarise, he presented to the GP with right calf pain, positive D-dimer but negative ultrasound. So the discussion centred around how high was the D-dimer and when was this taken, whether we should repeat it today, could this have been a lab error or an error with the ultrasound. So we decided to repeat the D-dimer, and it came back at almost 10 times the upper limit of normal. The question was clear. How should we investigate this? Should we look for a venous embolism with an ultrasound or CTPA, or should we look for a cancer? So we decided, given that he had a raised D-dimer with an episode of sinus tachycardia and calf pain, that we needed to rule out a condition that could kill him tonight. So we did a CTPA, and it came back and showed bilateral PEs, unprovoked. So we started him on a DOAC and asked the GP to follow up duration and further investigations. A quick look at the evidence. A D-dimer 10 times the upper limit of normal equals an ultra-high D-dimer. Ultra-high D-dimer is associated with trauma, surgery and infection, particularly pneumonia, blood clots, cancer and other pathologies. Has a 90% risk of serious pathology with a 50% risk of VTE and a 25% risk of cancer with an increased mortality. Here are some of the references. You can pause the video to have a better look. So to summarise, an ultra-high D-dimer is defined as 10 times the upper limit of normal, has a 90% risk of pathology with increased mortality, a 50% risk of blood clots or 25% risk of cancer. No obvious cause, i.e. infection, trauma or surgery, exclude VTE due to the risk of death, and consider cancer on a case-by-case basis. Hope you enjoyed the case and see you next week.